Hello and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be with us today.
And I'm Jean Marie. Today we are diving into a topic that touches millions of lives every year, diabetes.
Exactly. We're taking a structured, fact-based look at what diabetes is, how it develops, how it's diagnosed, and what people can do to manage it.
At its core, diabetes mellitus is a disorder of how the body regulates blood glucose. Glucose is the main fuel for our cells, and insulin is the hormone that helps that glucose move from the bloodstream into the cells.
That's correct. And in diabetes, that process breaks down. Either the pancreas doesn't produce enough insulin, or the body cells stop responding properly to it. That's a state called insulin resistance. The result is hyperglycemia, or high blood sugar, which over time damages blood vessels, nerves, and organs.
There are three main types of diabetes: type 1, type 2, and gestational diabetes. And there are a few more, but those are the three main types.
Okay. Type 1 diabetes is an autoimmune condition. The body's immune system attacks the insulin-producing beta cells in the pancreas. It often appears in childhood or adolescence, though adults can develop it too. People with type 1 require daily insulin to survive.
Type 2 diabetes is far more common. It accounts for maybe 90 to 95% of all cases. And here the pancreas still makes or produces insulin, but the body cells resist the action. Lifestyle factors such as excess weight, a lack of physical activity, and genetic predisposition also play roles in developing diabetes type 2.
And then there's gestational diabetes, which develops during pregnancy and usually resolves after delivery. So this is for the mother, not the child.
Mm-hmm.
The mother's future risk of type 2
can be influenced by the fact that she had gestational diabetes.
Oh, okay. I'm sorry. I missed that. And there are also rare forms of latent autoimmune diabetes in adults, also called LADA, and maturity onset diabetes of the young, or MODY, which combine traits of types 1 and 2.
According to the Centers for Disease Control and Prevention, over 38 million Americans have diabetes, and about 1 in 5 don't actually know that they do. Another 98 million have prediabetes or are at a pre-diabetic state, and the risk increases with age, especially after the age of 45.
Is that for everybody, or is that for people
I guess we should ask whoever wrote this.
Okay. Other factors include family history, obesity or high BMI, sedentary lifestyle, hypertension, high cholesterol, and certain ethnic backgrounds.
Those can all increase your risk of developing type 2 diabetes.
Okay. For women, a history of gestational diabetes is important, and some medications like steroids or antipsychotics can raise blood glucose levels.
It's also worth mentioning that veterans and first responders may see a slightly higher risk of due to increased stress and shift work, but diabetes is very much a worldwide public health issue affecting all people in all different groups.
Classic symptoms of diabetes include the 3 Ps: polyuria, excessive urination; polydipsia, excessive thirst; and polyphagia, increased hunger. People also notice fatigue, blurred vision, slow healing wounds, and unexplained weight loss.
For type 1 diabetics or people living with type 1 diabetes, symptoms can develop quickly over days or weeks. Type 2 often creeps in, those symptoms often develop slowly, and sometimes it can take years before someone is diagnosed. That's why screening is crucial for anyone with risk factors.
And for screening, doctors use blood tests to diagnose it. The most common are A1C, which is a fasting plasma glucose, and the oral glucose tolerance test. Each has specific cutoffs defined by the American Diabetes Association.
And there are specific numbers, but your doctor will or healthcare provider will go over
Based on your results?
those.
Okay.
The results.
All right. Early detection makes an enormous difference. People with diabetes,
Who are pre-diabetic
diabetes, yes,
or living with in a pre-diabetic state.
can often reverse it through diet and exercise before permanent damage sets in. Now, let's spend a minute on what's happening inside the body.
Okay.
When we eat, carbohydrates break down into glucose. The pancreas responds by releasing insulin, which helps cells absorb that glucose for energy.
And as we kind of mentioned earlier, in type 1 diabetes, the pancreas can't make insulin properly. In type 2 diabetes, the cells basically ignore insulin signal. Either way, the blood sugar in the system rises, and over time, the pancreas gets overworked and starts to fail, which actually makes the situation worse.
Well, high blood sugar acts like a slow toxin. It thickens the blood, damages vessels, and alters nerves. That's why it affects so many systems from eyes, kidneys, to feet and heart.
So that's the basics in understanding what diabetes is and how it's diagnosed. But now let's talk about management. How can people live well with diabetes and prevent complications? Well, the goal of diabetes care is often to keep the blood glucose levels as close to a normal baseline as possible without causing hypoglycemia or low blood sugar. And that means balancing medication, nutrition, physical activity, and monitoring.
Exactly. It's like a four-legged stool. If one leg is missing or unstable, the whole system tips over. Medication alone isn't enough. You also need consistent habits, informed decisions, and regular follow-up with the care team.
Most people who are living with diabetes work with several different professionals. They typically will have a primary care provider. They may also work with an endocrinologist, a certified diabetes educator, a dietitian. Sometimes a pharmacist will also play an active role, as well as a podiatrist, an ophthalmologist. All those individuals might need to play a role due to
The damage that
the widespread effects that diabetes can have on the system.
Right. One of the biggest changes in recent years is how people monitor their blood sugar. It used to mean finger stick testing several times a day. Now, many patients use a continuous glucose monitor, or CGM.
CGMs measure blood glucose CGMs measure glucose in interstitial fluid, which is the fluid underneath the skin, and they can take readings every few minutes and give you real-time feedback. And this allows you to make adjustments to what you're eating or what activities you're participating in, and your medication as well before glucose gets too high or too low.
Data from these devices can be shared with clinicians through secure apps. This has truly transformed diabetes care, reducing emergency visits and helping people recognize patterns that they couldn't see before.
And let's take a moment to talk about medication. For those individuals living with type 1 diabetes, insulin replacement is essential. There really is no other option. And before, insulin replacement was a viable option, people didn't grow up to be adult type 1 diabetics. There are different formulas. There's fast-acting or rapid-acting, short-acting, immediate, long-acting, or even ultra-long-acting insulin options.
These insulin products can be delivered by syringe, insulin pen, or pump. Pumps provide continuous basal insulin and can deliver boluses with meals. When paired with a CGM, some pumps now form what is called a hybrid closed-loop system. Essentially, it's an early form of an artificial pancreas.
For individuals living with type 2 diabetes, treatment often starts with lifestyle changes plus medications such as metformin, which is a medication that improves insulin sensitivity and decreases glucose production in the liver.
If metformin alone isn't enough, Doctors may add other classes such as SGLT2 inhibitors, GLP-1 receptor agonists, DPP-4 inhibitors, or sulfonylureas. We'll say that that's right.
Mm-hmm.
Each works differently. Some help the body release more insulin, some slow digestion, and others increase glucose excretion through urine.
GLP-1 medications, and you may have heard about a number of these in the news recently, they're newer and also can support weight loss. And they've been shown to reduce cardiovascular risk, which is critical since heart disease is the leading cause of death in people who are also living with diabetes.
And nutrition remains the cornerstone. There is no one diabetes diet, but the goal is steady, balanced intake that minimizes spikes in the blood sugar.
The American Diabetes Association recommends emphasizing non-starchy vegetables, lean protein, and high-fiber carbohydrates while limiting refined sugars and saturated fats and alcohol.
Carbohydrate counting helps many patients. Knowing how many grams of carbs are in a meal allows proper insulin dosing. A dietitian can teach individualized ratios and portion control.
The plate method is one simple visual guide. Half of the plate should be non-starchy vegetables, 1/4 lean protein, and 1/4 whole grains or starchy foods. Plus, you want to have water or other unsweetened beverages with your meal.
Timing matters too. Eating consistent meals spaced evenly throughout the day prevents large swings in glucose. Skipping meals or binge eating later can destabilize control.
And don't forget, again, we said, you want to make sure that you're having fluids. So hydration is key. Dehydration can concentrate the blood sugar, especially in hot weather or during an illness or when you're dehydrated.
I never thought about that.
So, you want to make sure that you're drinking unsweetened beverages and limiting or eliminating any alcoholic beverages.
Okay, and exercise increases insulin sensitivity, and it's often one of the most effective ways to lower blood glucose naturally.
The American Dietetic Association suggests at least 150 minutes of moderate activity per week. And this might include, brisk walking, swimming, or cycling, and spread across at least 3 days. Resistance training 2 or more days a week also helps maintain muscle mass and metabolism.
People using insulin or certain oral medications should check their blood sugar before and after exercise to avoid hypoglycemia. Carrying a quick source of glucose like tablets or juice is also important.
And consistency in exercise is key. Even short 10-minute walks after meals can blunt post-meal glucose spikes.
Weight loss of even 5 to 10% can significantly improve blood sugar control in a type 2 diabetic. It decreases the insulin resistance and reduces the need for medication.
That said, healthy weight loss should be gradual and sustainable, about 1 to 2 pounds per week. Extreme diets or skipping meals can backfire on you, especially for those who are taking insulin.
Right. Behavioral support, food tracking apps, and group programs can help people stay accountable. The CDC's National Diabetes Prevention Program offers structured coaching for those with prediabetes to delay or prevent progression.
Stress hormones like cortisol can also raise blood sugar. So relaxation techniques, deep breathing, mindfulness, yoga, etc. have been shown to improve glucose stability.
And sleep matters too. A lack of sleep increases insulin resistance and appetite hormones. Aim for 7 to 9 hours of consistent, quality sleep each night.
And we talked about continual glucose monitors earlier. And in regards to that, technology continues to evolve rapidly, and insulin pens now record dosing history and can sync with mobile apps.
Smart pumps or closed-loop systems adjust insulin delivery automatically based on the sensor readings. There's even research into glucose-responsive insulin that could activate only when needed.
And there are issues with these technologies as well. Sometimes you need to have backup systems, and there can be some problems with it. So you want to make sure you talk to your healthcare provider about what to do in those situations. Telehealth also makes diabetes education and follow-up more accessible, especially for people in rural areas.
Well, so far we've covered day-to-day management, how to eat, move, and monitor effectively. But diabetes management also means preventing long-term complications.
Exactly. So let's talk about the possible complications of diabetes and how to prevent them, and the importance of emotional and mental health support. Let's start with short-term emergencies, because they can be life-threatening if left untreated. The most common are hypoglycemia, diabetic ketoacidosis, and
Hyperglycemic
HHS.
state. HHS, okay. Hypoglycemia means that the blood glucose drops below 70. Symptoms include sweating, shaking, confusion, irritability, and in severe cases, seizures or lack of consciousness. It's treated quickly with 15 grams of fast-acting carbohydrate like glucose tablets, juice, or regular soda, and then rechecked in 15 minutes.
Diabetic ketoacidosis, or DKA, typically or usually occurs in type 1 diabetes conditions when the body lacks insulin. Your body starts to produce ketones from the fat breakdown, and it makes the blood acidic. Signs may include nausea, vomiting, abdominal pain, rapid breathing, and a fruity smelling breath. It's a medical emergency and typically requires IV fluids and insulin.
Oh, good to know. And the HHS state, I guess HH state, happens mostly in older adults with type 2 diabetes. Glucose levels skyrocket, often above 600, but without significant ketones. It causes severe dehydration and confusion. Again, immediate hospital treatment is needed.
Chronic high blood sugar damages small and large blood vessels throughout the body. And that's why individuals who are living with diabetes may also have issues with their eyes, kidneys, nerves, and heart.
Well, let's start with eye disease.
Okay.
Diabetic retinopathy results from damage to the tiny blood vessels in the retina, and it can cause vision loss or blindness if untreated. Yearly dilated eye exams are crucial for early detection.
Kidney disease, or diabetic neuropathy. Nephropathy.
Nephropathy.
Develops gradually, and protein begins to leak into the urine. Kidney function slowly declines, and keeping your blood pressure and your glucose levels well controlled can slow or prevent this from developing.
Okay. Neuropathy, or nerve damage.
I thought we were, yeah.
Right. That can cause numbness, tingling, or pain, especially in the feet. Because people may not feel injuries, foot ulcers and infections are common. That's if you have the numbing.
Right.
Numbness.
So individuals who are living with diabetes need to be very careful with their feet.
And check their feet daily and wear proper footwear and essential prevention steps like seeing a podiatrist.
Right, because you can, injure your foot, and it can take a long. It also the diabetes can slow healing, and that can be a real issue with extremities. And then there's cardiovascular disease, which is the leading cause of death in individuals with diabetes. It increases diabetes can increase your risk of heart attack, stroke, and peripheral arterial disease. Managing your blood pressure, cholesterol levels, and avoiding tobacco can all help lower your chances of cardiovascular disease.
Okay. And let's not forget dental health.
Okay.
High glucose encourages bacterial growth in the mouth, leading to gum disease. Regular dental cleanings and good oral hygiene are part of diabetes care.
Preventing complications is really about consistent monitoring, early detection, and making sure that you have that healthcare team in place. The American Dietetic Association recommends routine A1C checks every 3 months or so, and an annual lipids panel, kidney function tests, and foot and eye exams for those individuals living with diabetes.
And blood pressure should be checked at every visit. Vaccinations are also important. Flu, pneumococcal, hepatitis B, and now COVID-19 boosters are appropriate. Infections can worsen glucose control and increase complications.
Managing your diabetes care may be emotionally exhausting and does require that you are constantly paying attention, to what you eat, when you move, monitoring your blood glucose levels, taking proper medication, and you might get, exhausted by all of this.
Yeah, diabetes distress is a real studied condition. It's not clinical depression, but it's the emotional fatigue of living with the chronic disease. People often feel guilt or frustration when numbers aren't perfect, even when they're trying their best.
Individuals might want to seek out support groups, counseling, or talk with a diabetes educator to make, changes and to take some of the weight off, emotional, weight. The Centers for Disease Control, the American Dietetics Association, and many hospitals also have groups for education and also providing peer-to-peer support, both in person and online.
For anyone feeling overwhelmed, it's important to reach out for help. Mental and physical health are tightly connected. Stress hormones directly affect glucose control, so self-care isn't optional, it's a part of treatment.
And let's talk about practical quality of life tips. You may want to keep a small emergency kit handy, including glucose tablets, your ID card, spare insulin if you can, or other medications that you're taking, or a list of your medications and other snacks.
Okay. And rotate your injection or sensor sites to prevent lipodystrophy, which can affect insulin absorption. Replace the glucose meters or sensors per manufacturer recommendations because accuracy matters.
And we've talked about it at least twice now, but third time can't hurt. You want to stay hydrated. You want to get enough sleep, and you want to maintain your commitment to your condition. So you want to make sure that you're following up with the appropriate healthcare providers. It's a marathon, and it's your life, and you need to. You're taking an active role is vital.
Right. And remember, small, consistent improvements add up over time. Every percentage point reduction in the A1C lowers the risk of complications significantly.
Diabetes is now one of the top 10 causes of death globally, yet much of it is preventable or manageable. Community programs, workplace screenings, and school education can also help raise awareness. For those who are currently living in a pre-diabetic state or with prediabetes, structured lifestyle programs can cut progression risk by more than half.
Technology and research continue to evolve, from artificial pancreas systems to advances in beta cell transplantation. There's hope that in our lifetime, type 1 diabetes may become a curable condition.
So let's go over this one more time. We talked about the types of diabetes and how they can affect your body, that you need to keep blood glucose levels, blood pressure, and cholesterol all within target ranges whenever possible. It's vital to eat a balanced diet, move regularly, and take your prescribed medications as directed. You want to monitor for early signs of complications and take care of your mental health. And if whenever possible, build a support network so that to take some of the pressure off.
Right. And most importantly, remember, you're not alone. Millions managing diabetes successfully every day with the right knowledge and care are with you. That wraps up today's episode of PodcastDX. Please join us at our website, PodcastDX.com, to learn more about this topic and many others. And don't forget to follow us wherever you get your podcasts.
But not like to the follow us around. Okay. This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.